My name is Kayla Bragg. I'm an RN in the BSN program at Bluefield State College, and today I'm going to be talking to you about chlamydia, which is my communicable disease topic. Chlamydia is caused by Chlamydia trachomatis, which is a type of bacteria. And an interesting fact about chlamydia is that it is the most common and most prevalent of all sexually transmitted infections in the nation. Chlamydia is a nationally notifiable disease, and currently it is the most common of the notifiable diseases. And as a nurse, you might wonder, okay, who am I reporting this disease to? And typically you will report that to the health department of any new cases that you may find in your facility or clinic. The population affected, young women are among the most highly affected by chlamydia. It is most common in teens and young adults in the ages of 15 to 24. In the year 2013, there were 1,401,906 cases of chlamydia that were reported to the Center for Disease Control. That translates to about 446.6 cases per 100,000 in the population. Transmission of chlamydia is through sexual contact, or also it can be transmitted through infants during the birthing process as they pass through the birth canal if the mother is infected. Signs and symptoms. According to an article published by the Journal of Clinical Nursing, approximately 80% of all people who have chlamydia are asymptomatic, so they will not show any symptoms at all. Women may have abnormal vaginal discharge, inflammation of the cervix, and bleeding or spotting between their periods. Men may have abnormal penile discharge and pain or burning upon urination. Both males and females may experience urethritis or painful urination upon infection. In the infants that are infected during the birthing process, they may exhibit symptoms of conjunctivitis, like redness or drainage in the eyes due to passage of the bacteria through the mucous membranes of the eyes, and some may even develop a respiratory infection or pneumonia from that as well. Complications, it would include women. They may get pelvic inflammatory disease, ectopic pregnancy, premature delivery, and infertility problems. And men may get epididymitis, and even they may become sterile in some cases. So we'll move on to next, how would you diagnose chlamydia? It is diagnosed through a nucleic acid amplification test, and these tests are backed up by the FDA. They're highly sensitive. They can be used with swabs from urogenital sites like the cervix, vaginal, male urethral specimens, but more commonly they're just tested through urine specimen, and those are considered to be just as effective. Chlamydia is treated with antibiotics, usually azithromycin, and we as nurses should educate patients on the importance of completing their round of antibiotics. And the CDC recommends that antibiotic treatment be dispensed on site when possible to ensure compliance with treatment. And we as nurses should also educate our patients on abstaining from intercourse or other sexual contact until their treatment is completed, so that they don't pass it on to others. Sexual partners should also be notified for the patient's request, or we should also encourage them, if they don't want us to contact them, they should notify them themselves so they can ensure treatment as well, and also to prevent reinfection. Next, we want to talk about prevention. Prevention of chlamydia, as with other sexually transmitted infections, abstinence would be the number one priority. For those who do not practice abstinence, they should stay away from risky behaviors such as multiple partners, avoiding sexual contact with someone who's known to be infected, unprotected sexual contact, and having multiple partners or partners who are not monogamous. Nurses can educate patients on signs and symptoms, on prevention. We can participate in screenings in the clinics or facility where we work at. We are working close with patients, so if we see a high-risk patient, maybe we can suggest that they be tested, and we can also educate them on the importance of treatment and complying with that treatment. because nurses play a vital role in disease prevention and treatment. And by taking part in these simple behaviors, hopefully we can help prevent and decrease this epidemic.